The second wave to date, our long-term care and retirement home outbreaks have remained small and stable. And there has been an incredible amount of work behind the scenes to try and keep it that way. But we are seeing provincially such outbreaks increasing significantly in other areas of the province, with case numbers growing rapidly and deaths rising. So this remains a major risk in any community with elevated rates of spread, such as in Waterloo region. Regarding schools, the number of cases and outbreaks in our schools, while they have been trending upwards, is increasing in line with the overall case growth in our community. Due to the measures that are in place, which are quite conservative for schools, outbreaks have been well controlled, and spread has been limited to date. Again, a lot of work behind the scenes to prevent further spread. However, we've seen this elsewhere as well. The more spread increases in our community, the more schools will be impacted. And finally, similar to other health units in the red and lockdown zones, we have been challenged to reach positive cases within 24 hours. So last week I had mentioned that we had averaged around 50% in the preceding week. Our ability to reach cases has recently improved to around 80%, but our capacity is very stretched and it is fragile. If you take a look at our, the next slide, please. Thank you. If you take a look at our hospitalizations and ICU admissions, we see that, as we see often after there's been a rise in cases, there's a bit of a lag, but then afterwards our hospitalizations increase and our ICU admissions increase, and that's what we've seen in the region. And so hospital capacity is also continuing to be strained by the increasing number of hospitalizations and ICU admissions. So if we go to the next slide, please. So this slide shows the percent of workplace or facility or business outbreaks in the month of November alone, because that's been our busiest month. And it shows the most frequent types of settings that are experiencing outbreaks. So I mentioned that the number of outbreaks in long-term care and retirement homes and schools were fairly low and in general well controlled. That's good so far. Where we are seeing the most outbreaks and what is driving a lot of our spread are workplace and business setting outbreaks. So you can see the most common settings are manufacturing, industrial, restaurants and bars or food and drink establishments, trades and related services, sports and fitness settings, general office settings, and construction settings. And I think the most important takeaway is what we most often see in workplace and business settings across all these sectors is employee to employee spread in the workplace. There's obviously also employee to employee spread outside the workplace if they socialize together, for example, but we don't count those as workplace outbreaks. Workplace outbreaks are declared when, upon investigation, transmission is thought to have most likely occurred in the workplace itself. The second most common occurrence is when clients spread it amongst each other. And an area where we often see that is in sports settings, where there is insufficient or inconsistent physical distancing and no masking while engaged in physical activity. So that is one of the reasons, we have been saying for a while now that we're seeing spread in workplaces, most often in employee-only settings between employees, and we want there to be greater awareness about those trends, so that employees can take action and try to minimize those instances where possible. So, if we go to the slide. The situation in Waterloo region is serious. Regarding the question of whether Waterloo region would be moved by the province into lockdown zone this Friday, there are no set criteria for the lockdown zone. What's in the framework is that areas of the province may be placed in lockdown if their situation continues to get worse after entering the red zone. There is ongoing consultation between the province and ourselves on what is best for Waterloo region in order to help slow the spread and reverse the trends. We are also continuing discussions with the province regarding additional supports for our case and contact management and enforcement. On the one hand, our indicators have worsened. On the other hand, it takes more than just a week to see the impact of restrictions. Therefore, what I'm saying is we need to monitor the situation in Waterloo region very closely. And most importantly, we as a community need to act now. Many of us have already taken these actions that I'll reiterate in just a moment. And I really want to thank the citizens in our community who have done that. We need many more of us to take these actions. Business restrictions and lockdowns are very, very hard. So please, let's all do our part. It is crucial that as a community, we dramatically reduce our non-essential social interactions. Please do not have non-essential social interactions with people outside of your immediate household. That means no birthday parties with those outside of our household, no sleepovers, no play dates, no coffee dates, no game nights, no days. And please, only go out for essential purposes. And finally, when you shop, please support our local businesses. And that's all for my update. Happy to take any questions.
Thank you, Dr. Wong, and it's a sobering picture and good to know. I'm waiting to see. I'm assuming you have some questions. I just can't. Okay, Councillor Harris.
Thank you, Chair Redmond, and thank you, Dr. Wong, for your presentation. In light of obviously the situation we find ourselves here in the region of Waterloo with Code Red, the increased number of cases, and the clear need for additional resources from both the provincial and federal level of governments, I do have an advocacy motion for public health that I would like to table to my colleagues.
Go ahead, Councillor Harris.
All right, I'll just read it here. And I'll send it to Tim, I guess. Would that be the best way of doing that?
Just please send it to Chris Fletcher. Thank you.
Chris Fletcher, okay. So I would like to direct the head of council to urgently advocate to the provincial and federal governments for continued support for Waterloo region to deal with the increasing demands of the COVID-19 pandemic, specifically to request an increase in case and contact tracers, as well as continued support for enforcement from provincial multi-ministry team equally and in proportionate to the support that has been provided to the other regions in the red or gray zones of the provincial framework to assist Waterloo region to slow the spread and avoid a move into lockdown. Further, that this message be shared with all regional council, heads of council, and local MPPs and MPs, so the message from Waterloo region is amplified to both levels of government. And I'll send it to Chris here now.
Thank you, Councillor Harris. That's been moved by Councillor Harris. Do we have a seconder? Okay, Councillor Jowett. Discussion on that motion or questions of Dr. Wong? Councillor Vrbanovic.
Here we go. Thank you very much, Chair Redmond, and thank you, Dr. Wong, for no doubt a very challenging report, but an important one at this critical stage. Specifically, and I think the motion speaks to some of those things. But are there specific asks that we have of the provincial government, or is it mainly around contact tracers? Is it around more enforcement? I'm wondering if you can speak a little more to that. Dr.
Wong?
Yeah, I would say it's more than contact tracers, because we do have some assistance now from the province, but it's actually case investigators that we need more of, because there can be some assistance provided by people who don't need specialized skills, for example. And the problem is, once you start to get a lot of cases, it's not simply following up with people, for example, that have no symptoms and are fine, have no questions. It's actually, investigating and attending to their to their needs when they become symptomatic, when they become cases, and then, of course, really trying to piece together spread. And trying to, investigate to the point where we can best do interventions to then try to reduce spread. So it requires skilled case investigators, and I know that there's been assistance provided to other health units that are also experiencing high levels of spread. And I believe the notion that we would have equitable access to those supports would be the most appropriate motion, because it would I think help increase our level of resources now that we have more recently surged, because other health units that have had some of these supports, they had earlier, so they had gotten some more support earlier.
Okay, thank you. And then the other question I have is you've issued a Section 22 Section 22 orders in recent days, and I know that they were very difficult decisions for you, but ones that, quite frankly, based on the epidemiological evidence that you had, needed to be made. And I know there's been some folks who have questioned that and so on. I'm wondering if you can use this opportunity to really explain, why we needed to do this, and give some assurance to folks in terms of, this is a temporary issue until we get those numbers under control.
Dr.
Yes, sorry. Thank you, Mayor Vrbanovic, for that question. Yes. Yeah, making an order is never something that, I take lightly, but especially in this situation, an order was made most reluctantly. When we started to see cases, and the partners, the healthcare partners, the community partners, and public health, we tried working with community leaders and members, and we have benefited from a lot of support from leaders and members of the impacted communities, and it's been really good. They've there's been lots of efforts to get the right messaging out there, to make sure that they have access to testing and medical supports and things like that. Unfortunately, though, what happened is that, despite a lot of intense work to really try to support the communities that were experiencing this threat, this spread, there was a continual reluctance by a number of people to comply with the public health measures that are required in order to help protect their themselves and their, as well as the broader community with whom they interact. And so what we also saw, concurrent to this lack of cooperation among a significant number, was the fact that cases continued to spread. And they spread quite quickly, as COVID tends to do when there are no actions taken, or insufficient actions taken, I should say, to try to control it. Its natural course is to spread exponentially. And so we started seeing that quick rise in numbers, in these settings. And so it was felt, I felt that it was necessary at the time to, put in place significant restrictions to help protect the community and help slow the spread, because uncontrolled spread across these communities threatens these communities as well as the broader Waterloo region. And so, we needed to take action. That said, we are continuing with partners to work very intently with community leaders and members to try to bring about the necessary changes in the most collaborative way that we can.
Thank you for that very thoughtful answer. And the last thing I just really want to do is more a comment, and that is just to thank you and your team. I know this has been it's been a long 9 months for all of us, but the last little while has been particularly challenging for you and your team. And on my behalf, and I'm sure all of my colleagues, thank you, heartfelt thank you for all of your leadership during very trying circumstances.
Thank you.
Thank you very much.
So we have a motion on the floor, and I'm going to give the last word to Councillor Jowett, who was the seconder. This was moved by Councillor Harris. Helen, you can have the last word, and then I'm going to call the vote because we have some people waiting to come to a special council meeting. Helen, you have the floor. You're on mute, Helen.
Oh gosh, sorry about that. Just a quick question with regard to the chart that showed the different industries where the employee-to-employee outbreak is occurring, Dr. Wong. And I don't want to create any kind of panic or anything, but we're still doing our curbside pickup at the restaurants and everything. So your contact tracing is proving more to be employee to employee, just so that everyone out there is clear, and not employee to patron, because we really think that is such a survival technique for our economy. So I just want to be clear that the message is what is correct to us. Is that what you're telling us?
Yes, you're correct, Councillor Jowett. It is rarely employee to patron. It is by far much more frequent that it is employee to employee in employee-only areas, followed by, patron to patron. No,
Thank you for that.
And I think it's been because of the measures that the different businesses have put in place, because I know they have been very diligent in putting in place measures, and that has helped tremendously.
Thank you for that. That's just really important at this time to make sure that people know that it's still safe for curbside pickup. So thank you so much, Dr. Wong, and thank you for everything you're doing for us.
Thank you. And thank you for somewhat sobering but very necessary update, Dr. Wong. So we have a motion before us, moved by Councillor Harris, seconded by Councillor Jowett. I would ask everyone to use their voting icons to vote yes or no for this motion, which is to continue focused advocacy on behalf of Waterloo Region as the Board of Public Health. We all know that we had some extra horsepower over 2 weeks for enforcement and inspection, and I think that was really helpful. I know, Dr. Wong, do you have a last word? Okay.
No.
That is carried. So thank you, colleagues, for this. And again, Dr. Wong, on behalf of what we now know is the 630,000 people in Waterloo Region, thank you for everything you and all of your colleagues do. We now have a motion to adjourn, moved by Councillor Clark and seconded by Councillor Armstrong.
Madam Chair, just before you do, was that last motion unanimous?
Not quite.
Oh, okay.
Thank you. I bet you this motion will be Councillor Vrbanovic. So now you can all vote on a motion to adjourn. Please do not leave this Zoom stream because we will be going into our public meeting.